Good morning and welcome to another episode of Coffee and Tea with AARP, a bi-weekly conversation in which AARP staff and volunteers talk with experts and decision makers about policies and programs that are of interest to older adults. My name is Doroghazi and I'm one of the policy directors at AARP Connecticut. Our topic for today is prescription drug affordability, and I'm looking forward to having this important conversation. Before we get started, I want to introduce today's volunteer co-host, Lloyd Stableford.
Hello there. I'm an AARP Connecticut volunteer. I actually volunteer for the area of advocacy, tax aid, counselor, and a driver safety instructor. And vis-a-vis the issue at hand, I did a little study of my own medical situation. I had some heart issues last year, and I discovered that of all the medications I have, 2 of them cost me 62% of my entire medical bill in terms of drugs. So I'm quite interested in finding out what we can do about that.
Great. Yeah, thank you, Lloyd. We hear from folks all the time that are struggling with this issue. So I'm really pleased that this is our topic for today. And thanks again for being with us and for all of the really great volunteer work that you do on behalf of AARP Connecticut. It is also my pleasure today to introduce our special guest, Jon Bartholomew, one of AARP's senior legislative representatives with the AARP Government Affairs team. Jon is one of our national experts on prescription drug affordability, and we are really excited to have him with us today. Hello.
Hey, good morning. Thank you both for having me.
Okay, Jon, to get started with today's conversation, we'd like to hear from you about the AARP's Government Affairs team and the work that you do.
Sure, absolutely. The Government Affairs team provides public policy expertise, strategy, and resources to accomplish the mission of AARP. We have issue experts who advocate in Congress on such issues as Medicare and Social Security, prescription drug reforms, and many other issues at the federal level. And we also have folks who assist the state offices of AARP with state and local advocacy. My job is to assist state offices with state level legislation regarding prescription drug prices and other drug related issues. So I review legislation, provide sample testimony, I help with the messaging, related issues like that. And I also we have a bunch of different departments that work together to ensure that state offices get what they need, whether it's like facts and figures or direct advocacy help. We have all these different teams that work together to make sure we can make life better for today's 50+ population and the generations that follow.
Yeah, and I really love our government affairs team, and you all do terrific work and make it possible for us on the state level to keep showing up in state houses across the country for our AARP members. So we really appreciate everything you do. And I know you mentioned that your policy area where you do a lot of your work is around prescription drugs and prescription drug affordability. And I think most of the folks who are watching this are aware, because most of us are, that prescription drugs are prohibitively expensive for some folks sometimes. But for people who might not be, especially familiar with this issue, could you speak a little bit about the extent of the problem of drug affordability and how it impacts older adults in particular?
Yes, absolutely. Americans pay 3 times as much as what people in other countries pay for the exact same drugs. And we're sick and tired of it. We're all sick and tired of this. As a result, every month, millions of Americans have to make difficult decisions about whether they can buy their prescription drugs that they need, or if they can pay rent or pay for food or their utilities. In a recent AARP survey, more than half of voters over 50 were worried about being able to afford the medications they or their family members need. So it's no wonder that older adults worry about the cost of prescription drugs. I mean, we've tracked price trends for nearly 2 decades, and our research consistently finds that prices for brand name medications, most often used by seniors, are increasing much faster than prices for other goods and services, well beyond the rate of inflation. Our newest prescription drug price watch report, which you can find online, looked at specialty drugs that treat complex chronic conditions and found that the average cost to use one of these drugs for a year was $84,442 in the year 2020. That's nearly 3 times the annual income of somebody who's on Medicare. So when you compare it to other goods, you can see how big a deal this is too. Like if you look at the amount that prices went up on some of the most commonly used drugs between the year 2006 and 2020, and you applied that same percentage increase to milk, milk would be over $13 a gallon right now. Gas prices would be over $12 a gallon, and a single movie ticket would be over 24 bucks. Now, these price increases are simply unfair.
John, how did we get to this point? Is there a historical reason that we reached this point where drugs are so high?
Yeah, there's a number of different factors to this, but I can distill it all down to one basic thing, and that's that the market is broken for prescription drugs. If you need a drug, you need it, and whoever supplies it can charge the most they can possibly make off of you. In economics terms, it's an inelastic demand curve. It's like, you don't have a choice. You have to get it. Therefore, if you're the only supplier of the drug, you can charge whatever you want as long as you can get that amount, just as much as you can possibly do. So, and due to patents and sometimes abuse of patent law, drug manufacturers essentially have monopolies for many years on a particular drug. And they do everything they can to hold on to that monopoly, including something called pay for delay, where they provide something of value to generic drug manufacturers who are planning on bringing that, a generic version to the market. And so they say, all right, well, we'll give you this as long as you delay bringing competition to this marketplace. And without competition, a drug manufacturer has no reason not to increase prices. And another big reason why we got to this point is that Big Pharma spends a significant amount of money and effort on politics. Just in the 2020 election cycle, drug companies donated over $13 million to candidates for Congress. And same year, that industry spent a record of $306 million lobbying Congress. And that's just the federal level. At the state level, these drug companies spent over $9 million in campaign contributions across the US to more than 2,400 candidates. And I don't know exactly how much they spent on direct lobbying at the state level. I haven't seen the numbers for that, but it's tens, maybe hundreds of millions of dollars. Those of us who have worked in state capitals know that there's usually a lot more pharmaceutical company lobbyists than there are lobbyists who are trying to stand up to them. So through all of this, they work to get elected officials to do what's in their best interest of their bottom lines and not what is in the best interest of you and me.
Yeah, so you did mention that we've at AARP have been showing up in state capitals and also in Congress to address the issue of high prescription drug prices. People might be a little more familiar with some of our federal legislative advocacy, and folks who aren't can visit www.aarp.org/rx to learn a little more about the really important federal work that we're working on. So I'd like to ask you a couple questions about what is going on in state legislatures. It's a lot to keep track of, I'm sure, on your end, but what are a couple of the state level policies that you see AARP state offices supporting around the country?
Yeah, that's a great question, because there is no one silver bullet to really address the problem of high prescription drug prices. So we've been supporting a variety of different approaches to address this issue. First, just to get a handle on the problem itself, we've been advocating for drug price transparency laws across the nation. Many states have passed these. They're designed to require drug manufacturers to explain why they raise drug prices beyond a certain threshold. And what's interesting about that is that already we're seeing some evidence that the drug companies have decided to not raise their prices quite as much as they used to because they don't want to trigger the transparency requirements. If they raise the price over 10%, they have to do all sorts of reporting. And so we're seeing a lot of drug price increases of 9%, not 10. So that's one thing we've been doing and been successful on across the country. We've been advocating for states to be able to import drugs from Canada. And several states have enacted laws like that. They haven't been put into effect yet, but they are moving forward on that. And now we're supporting bills to import the price of the drug from Canada. That's called international reference pricing, where you say, okay, well, this is the exact same drug in Canada. How much do they pay for it there? Well, can't we set an upper payment limit, a maximum amount a payer can pay in our given state? And we've also been supporting other approaches like increasing bulk purchasing systems, banning those pay for delay practices that I mentioned earlier, so that more generic drugs can come to the market to compete, and a number of other things, including what I know we're about to talk about.
Well, you're anticipating the next question, John. AARP Connecticut is advocating for a prescription drug affordability board. And could you share some comments about that?
Absolutely. I mean, so if the Connecticut legislature enacts a law creating a prescription drug affordability board, it'll be a body made up of experts on the issue, and they can set an upper payment limit for payers in the state to pay for that drug. So the board will analyze, the price of drugs beyond a certain threshold for affordability. They'll analyze information about whether or not that drug price is justified. And if it finds that the drug price is not justified, the board can set this maximum amount that a payer can pay. It doesn't affect the price set by the manufacturer. They still have the right to try to set their price whatever they want. But what this does, it creates a maximum amount you can pay. And that means that your state employee healthcare system would not pay beyond that cap. Insurance programs would only have to pay a certain amount. And that would mean fewer tax dollars spent on paying for drugs, lower insurance premiums, because these laws have mechanisms put in that say if the insurance company pays less for drugs, they have to show that they're essentially putting that money back towards consumers and lower premiums. And it also means less expensive drugs for anybody who has to pay out of pocket. Several other states have already enacted laws like this, such as Maine and New Hampshire, Colorado, and Maryland. And in each of these states, the boards are just getting started with their work. So, we believe this is a really good approach towards reining in like the most expensive, overpriced drugs that we have on the market.
Great. Yeah. And as you mentioned, this is something AARP Connecticut's going to be working on during our 2022 legislative session, where we're excited to start having these conversations with legislators legislators and our membership. So here's my question for you. Everything you've been describing sounds very reasonable. So whether it's prescription drug affordability boards or reference pricing or pay for delay, and in addition to being reasonable, they have potential to save lives. Why does AARP have to fight so hard to make progress on these issues? And why is it so difficult, both on the state level and federally, to pass any kind of legislation related to prescription drug reform?
Yeah. Well, I think I got to a big part of that earlier when I talked about the power of big pharma as a lobby. They contribute heavily to campaigns at the state and federal level. They spend an amazing amount of money on lobbying, and very often those investments pay off. They use scare tactics saying, oh, well, you won't be able to get your drugs if we have any kind of reforms to this. But it's like, well, you're selling these drugs for, 1/3 the amount in other countries. I think you're still going to sell these drugs. So it's mostly, an issue with the amount of profit they've made over the years and their ability to influence politics. That pretty much sums it up.
That people often wonder whether they can have any impact on the legislative issues that are out there. And this one in particular, does it make any difference if people reach out to their elected leaders?
Yes, and that is the flip side to this story, really. Well, elected officials, and candidates have to collect campaign contributions, and they have been from pharma. It is their constituents who actually cast the votes for them. And so elected officials still need you and me to be okay with them being in office. And if enough people contact their legislators to demand action on these outrageous drug prices, they'll get the message and they will do the right thing. We've seen it happen in state after state. This is not a red or blue issue. This is something that we're seeing happen in purple states, red states. There's all sorts of reforms that have been enacted in states from Massachusetts to Utah and everywhere in between on prescription drug prices. And, this issue really needs to be part of the conversation during the election season as well, so that candidates know that you want something done if they want to get elected. And once they're in office, they need to be reminded regularly that this is something that we need action on, because those lobbyists from the drug manufacturers are there every single day. They, and there's a lot of them. But if they hear from enough constituents, from you, your friends, your family, they'll have to listen.
Well, Jon, we're very fortunate in having you and your team work with us in all the various states. Is there anything else you might want to add today?
Well, simply that when enough people speak up, good things will happen. Whether it's at the federal level or the state level, there are ways that we can start to rein in these outrageous drug prices so that people don't have to make those decisions between whether or not they can pay for their drugs or their heat or their groceries or their rent. AARP is fighting for you. And we hope that you can join the fight so that we can help people today and help the generations to follow.
Great. And I think that just about sums it up. That's what we're all about here at AARP. And we really take seriously our mission to represent our members and to fight on behalf of the 50 plus. So thank you so much, Jon, for making time to speak with us today and for the great work that you do every day to support AARP's state offices on these important issues. And thanks so much to Lloyd, not just for co-hosting today, but you do so much for the state office, and it's really appreciated. And we're glad both of you were able to be with us today. If you're interested in learning more about AARP's legislative work or our upcoming events, please visit www.aarp.org/CT, or feel free to reach out to me directly at Doroghazi@aarp.org. Thank you for joining us today, and we hope you'll tune in again in 2 weeks for another episode of Coffee and Tea with AARP.